I want to thank the organizers for inviting me to be part of this conference, and I'm happy to share with you the information that I've been working with my colleagues and other colleagues in the United States on developing plans for reopening museums. A lot of our museums are just beginning to open, and more will be opening in the next couple of months, hopefully. I also want to say that I think it's important that museums develop flexible opening plans that can be regularly reviewed and refined based on the latest science. The guidance that I'm providing is based on the information that I had available and have been working with currently. And it's not intended to supersede any guidance from public health officials, medical experts, or federal, state, and local governments. I would encourage all museums to seek advice and consideration from their local public health service offices and local governments. So with that, let me start. I would first recommend that museums develop a phased timeline, as a gradual approach allows the museum to prioritize health and safety concerns while taking progressive steps to restore regular operations. It provides a certain amount of flexibility for regular monitoring of health and safety concerns, and allows you to make revisions if necessary. And one of the things we've been doing is in our reopening plan, we have phase one, which is somewhat limited access based on the number of staff we have, the number of visitors we want to allow in our spaces. And then phase two, we are expanding that somewhat, and we would go to phase two based on the current health and safety regulations in our area. And then phase three would be going to full services that we had more or less before we closed, but also based on current health and safety guidelines. So to develop these types of phases, I think it's very important to coordinate with your local authorities to make sure that current mitigation levels in your community are being followed, and you're coordinating your plans for reopening with the current health situation. You need to look at your local government and federal officials to see if any closure orders need to be lifted, and if the local public health departments need to provide any sort of clearance. I think it's also really important to coordinate with other museums in your area, because the museums together can help provide some consistency to the public when it comes to reopening. And also there's a certain amount of supply sharing that you can do. So I strongly encourage coordinating any opening plans with the other museums in your community. I think you need to assess the current existing conditions, which is looking at the downward trends in the local COVID-19 cases, and again, any sort of public health or federal guidelines around that. You need to look at your current staff resources. A lot of museums have furloughed or laid off staff at the beginning of the museum closures. So your museum may need time to recruit, hire, and properly train or retrain staff at all levels in operating safely, and you may need to train people in enhanced cleaning procedures. You may also need to hire additional custodial staff and security staff for the same reasons. And then you need to look at the availability of supplies and equipment in your museum. Before reopening, make sure that you have plenty of supplies to support the healthy hygiene for staff and visitors, to provide appropriate personal protective equipment, and to provide proper materials to clean and disinfect your facilities. And also, what's really important is to make sure that these essential supplies can be restocked as needed, because that's been an issue here in the United States. So you want to prioritize health and safety. Let me see. No way. I think I've gotten ahead of myself. There we go. Prioritize health and safety. And in your museum plan, you should include guidance from various health authorities, such as the World Health Organization. In the United States, it would be the CDC, the Occupational Safety and Health Administration, as well as any sort of orders from local and federal health officials. The best way to prevent illness is to protect against exposure from the virus. So your museum should promote measures for everyone, both staff, volunteers, and visitors, to avoid getting sick. And as an employer, you should take additional measures to help transmission and protect employees. These particular measures should include assessing the risk, consider who is at most at risk in your museum, take into consideration in terms of staff, their age, any underlying health conditions, as well as specific job duties. You should promote frequent hand washing, or if soap and water are not readily available, use of hand sanitizer that contains at least 60% alcohol. Make sure employees can take regular breaks to wash their hands. And at some point, you might consider offering hand sanitizer stations throughout the museums for visitors. You should ensure physical distancing, which in the United States we're recommending keeping 6 feet away from other people, and that needs to be emphasized for staff and visitors. If some staff are able to work from home, you should consider teleworking policies, as well as looking at staggering staff schedules, so that the museum may be open for a longer period of time, but you may have several staff shifts, so that you don't have all the staff working at the same time, and that you can reconfigure workspaces, look at visitor capacity and how you can limit access to decrease the amount of contact. You want to provide protective equipment to your employees based on the risk assessment and on workers' specific duties. Custodial staff and others who are cleaning and disinfecting are at an increased risk and should be provided with the appropriate PPE for cleaning and disinfecting. You can provide barriers like reusing exhibit materials such as plexiglass, creating protective panels to maintain distance between staff and visitors at an information desk, a ticket sales, etc. And then, of course, Cloth face covers are particularly essential in times when physical distancing is not possible, which can happen in a number of smaller museums and historic house museums. You should encourage or require the wearing of face covers by staff and visitors, except for children under 2 years old, and there are those who have chronic health diseases that makes breathing difficult. Keep in mind that transparent face covers such as shields are also helpful for individuals who are deaf or hard of hearing and rely on lip reading. Remind staff to cover coughs and sneezes, and you can provide tissues, and ensure that sick people stay home whenever possible, or at least leave the premises immediately. This includes implementing flexible sick leave and supportive policies and practices for staff. One idea is to identify an isolated room or area to separate anyone who exhibits COVID-like symptoms and immediately sending home or seeking medical attention for those with these symptoms. Okay, you should establish clear cleaning, disinfecting, and ventilation protocols for your museum. You can update your museum cleaning protocols based on, there's a number of organizations, including the ICOM CC's guidelines for cleaning and disinfecting facilities. There's other museum organizations that have come out with policies, but these all should be considered when you're reopening museums, so that the cleaning procedures and disinfecting of the buildings are improved. You will need to increase the frequency of cleaning of the high touch areas, such as touchscreens, bathrooms, doors, sink handles, water fountains, railings, keyboards, phones, and light switches. And some consideration should be given to doing a full deep cleaning every evening. Staff should be trained to wipe down surfaces between timed entry visitations if possible. You will need to allocate additional resources to cleaning above and beyond what you've done in the past. These heightened cleaning protocols may add extra costs for cleaning supplies and for cleaning professionals in the museum. And ensure that ventilation systems are operating properly. This can mean increasing the circulation of outdoor air into the museums as much as possible through ventilation systems, or by opening windows and doors using fans and other methods. But also keep in mind any safety or security risk in doing so. You may need to restrict contact, capacity, and access, which may mean some ideas would be creating online ticket sales for your museum, providing digital visitor guides and materials instead of physical copies at the museum, regulating interactives or touch screens. You can either just cover them up and turn them off and figure out, there's other ways of providing that information through videos or signage. Another idea is to provide disposable stylus pens that people would use to activate the touch screens rather than their fingers. And then as your plan progresses, you can consider installing hand sanitizer stations near these stations and encourage their usage when people are using touchscreens. Capacity restrictions for visitors should be considered, including time tickets for entry and monitoring traffic flow, which can mean only allowing so many people in a space at a given time. And that requires thinking that through and figuring out how many people are acceptable in a given space at a given time. You may have areas that initially you do not want to provide access to, such as theaters, cafes, and really high traffic areas or tight spaces in the museum. And then as you are progressing to different phases, you can start to open up some of these areas, depending on what the health situation is in your community. Some consideration should be given to canceling or restricting group visits, guided tours, public programs, and special or private events until the museum and the staff feels that it's safe to offer them and that you can limit the number of participants and practice social distancing. The use of signs or barriers to enforce physical distancing guidelines should be developed. I know in our case, we've completely developed a whole new set of signage that will be both physical signs, floor decals, etc., to encourage people to physically distance and to give people a better idea of what our policies are. One consideration for physical distancing is to establish a one-way flow through the museum to facilitate distancing. That may work for some museums and not for others. And then for outdoor spaces, you may want to consider closing restroom facilities and picnic areas. And look at ways of encouraging one-way travel and keeping people from clustering in certain areas. Another consideration is this is a good time to update your workplace policies and support your staff. Policies for employee leave, telework, and compensation should be reviewed and updated to protect your staff, to provide flexibility and ensure that sick employees are able to stay home when they need to. Also, you should consider the emotional toll on your staff and take steps to promote wellness. So it's important to actively monitor evolving health guidelines from all the various public health organizations. You should be reviewing the latest federal legislation for your area to make sure your museum is in compliance with any new provisions to support and protect employees. You want to help your employees to stay healthy with any sort of tips or information that you can provide them, and support staff mental health and well-being. The pandemic will affect the mental health and well-being of employees well beyond the immediacy of the initial crisis. So it's important to provide employees with resources and information about how they can, places they can go for support or any sort of stress reduction, substance misuse, etc. And keep.
Diana, I'm really sorry. We did run a little bit over with Darko's presentation, so
Okay.
just a few-minute warning, so we have at least time for a few questions.
Okay, so do you want me to quickly finish?
Take a minute to wrap up.
Yeah, okay. So basically you need to, if you're doing health checks, conduct them safely and respectfully and in accordance with any privacy laws and regulation. You might designate a specific person or team to be responsible for responding to COVID-19 concerns and make sure the staff is aware of how to contact them. Create a communication system for staff to report symptoms and notifications. It's important to train staff in safe interaction with visitors. Most staff are not prepared to deal with visitors who may not want to follow some of these health protocols like social distancing and wearing masks. So they will need specific training in this. And then it's very important to communicate clearly and frequently with your staff, with visitors, and with the local community about the protocols that you're implementing. You need to develop a written communication plan that can be available on your website and includes each phase of opening. And the most important thing, I think, is to connect with the broader museum community. And this is where a lot of the different museum organizations, such as ICOM, have a huge amount of information on their websites. And it's important that we get involved with these museum communities and help each other. And I would welcome anyone who's interested in joining the Disaster Resilient Museums Committee and help us develop guidelines and information and training for future disasters. And then the rest, I just provided some slides on museum resources that are available. There are a lot of information is available on different websites, so I just condensed a bunch of information. There's the American Association of Museums. They actually have sample reopening plans that you can download. There's the American Institute of Conservation that has a lot of information on cleaning, emergency plans, health and safety. There's the Canadian Conservation Institute that has a technical note on COVID-19, which also deals with cleaning, disinfecting collection spaces.
Diana, if you're okay, can we let Lana share this with the participants?
Sure. Yeah, that's the best way. And then,
that'd be great.
Of course, the Smithsonian has a great website as well.
Thank you very much. Yeah. Well,
so anyway, that's for people to be shared with everybody.
Yes.
Thanks very much, Diana.
Thank you very much.